Hey guys, just checking in again. I think where we left off the last time was I was going to get some testing done. So I ended up going to get my hysteroscopy and my hysterosalpingogram, and I actually declined the genetic screening, and I'll explain to you why in a minute. I went in to get my hysteroscopy, and I was just scared. I was freaking out. I am very nervous and anxious all the time, so that was a little bit interesting. So I went in there, and basically you go in, you change into, they don't even really give you a gown, they just tell you to undress your bottom half, and they give you kind of like a drape just to put over. So I lay back, put my legs up on the stirrups, and my doctor came in, and she kind of walked me through it. I was freaking out as soon as I saw the speculum. I do not like the speculum. I'm sure a lot of us girls don't like the speculum. Not only that, and not to scare you, but they were the metal speculums, which I've never experienced. Every time I've gone to the GYN, it's been a plastic one, disposable. So that was something new. I get myself really worked up about these things, and it's probably not as bad as I make it, but I end up asking my doctor, am I going to get any kind of numbing? And I'm very bad in the sense that I'll Google and I'll YouTube, and I watch just about everything to prepare myself. I don't like surprises, so sure enough, I went, she comes in and she tells me, look, all we're going to do is put the speculum in, and then there's this like long wire looking thing that I thought was literally a wire. It was not. It was like a flimsy silicone kind of long thin tube with a little camera at the end. And there's a screen next to the, basically like the bed you're laying in. And you can see everything. And I asked her, are you going to numb me? She's like, no, there is no numbing. But she did put some liquid in there. It's not an injection. I don't even feel it go in, honestly. And it's just to relax you, because I clench and I kind of tense up a lot, just because that speculum is so out of control. A tip for that would be bringing your bottom down all the way to the edge of the bed, so you're not in a flat place and the speculum can go in easy. So I ended up having a little tougher time than anyone that doesn't have this issue would. I have a posterior cervix, so my cervix goes a little further back, I guess, or is like a little deeper in, and it's kind of hard to just to reach with the speculum. So she had to use not a wider, but just like a longer speculum in order to reach my cervix. So honestly, all that freaking out was for nothing. It was uncomfortable, but it wasn't painful at all. After I got out of there and I went into the car, I was cramping, and that was very uncomfortable, but it's fine because I had already gotten the exam done, so I didn't care. I did have to cross the street and go to the hospital to get my hysterosalpingogram. So that was the same day, and it was probably like an hour after I had gotten the hysteroscopy. So I went and got that done. And honestly, it was the worst thing ever, if I'm being really honest. And this is, again, because of my issue with my cervix. So I figured, well, she gave me that like relaxant, so I should be fine. But it took an hour before they called me back. And so I went back there, and all that hysterosalpingogram is basically there's like a square x-ray machine that goes over you when you lay down, and you do the same thing. So you just scoot to the end of the table or the bed or whatever. And they do the same thing. Well, this was a different lady, and I told her, I'm like, hey, my doctor said if you could use, the longer speculum, same width, not any wider, because my cervix is so far back. So she tried. I was clenching at this point. I was just scared and in pain because it's almost like while you're getting this done, there's so much cramping. And I was already cramping from the hysteroscopy. So I ended up clenching so much. She was like, okay, I'm going to have to try the wider one, which I kid you not was probably like that thick. And it was just very uncomfortable. So it was uncomfortable to get that in, and it was just a mission. So after that, and I'm sorry, my TV's on, so I hope you haven't been listening to that the entire time, but they got that in, and essentially what that exam does is you're watching the x-ray screen, and you can see, like, they'll show you your fallopian tubes, and what the purpose of the exam is to inject iodine, I believe it was a dye, I'm not sure. And they want to see that the iodine flows freely through your fallopian tubes. That way they determine, is there a blockage, is there not a blockage, any kind of obstruction that would prevent you from possibly getting pregnant. So I was almost crying because I just felt so uncomfortable. They couldn't get that thing in. I must have been in that room for an hour, and it should not have taken that long. Again, I had a different, issue. It was my cervix. It was a little far back, so it was harder to reach. It was just uncomfortable. So at that point, I just hear them say, okay, so the dye is flowing freely through the left fallopian tube. That's great. I was happy. I was relieved. I'm like, you know what? It's cool. And then I hear her say, I see a little bit of flow on the right fallopian tube, but not too much. And I just start crying because I'm upset at this point. I'm like, of course, there's something wrong. And I was just, I think, exhausted. I think I just had it and I was done. So really the hysteroscopy was fine for me. It was no big deal. Don't stress it. It's really not a big deal. If you've had your regular annual pap smear, it's almost the same thing. Nothing crazy. The other one, I personally had a bad experience. I hope anyone that goes and gets that done has an awesome experience compared to mine. But that could have been just circumstantial. I mean, that was, again, my cervix is very posterior. I was told that. I do have a deviated uterus too. It's just a little bit deviated. So I'm glad it's over with, pretty much. That was on a Tuesday. So on Thursday, 2 days later, I had my ultrasound. So that ultrasound, I went back to the reproductive clinic and I had that done. And that was for your follicle count, I believe. So my doctor told me, she's like, you have the follicle there. I just don't see a follicle big enough to indicate that you're ovulating at the moment. So funny enough, I think I'm ovulating right now. And this test was done last Thursday. So at this point, I needed to learn to control my stress, to control my anxiety. I worry too much. Anything they tell me is just on me. It sets that pretty much as a negative thought. And I think that really, truly affects the outcome of everything. So I'm trying to think more positive. She did tell me, Evelyn, you've got to stop worrying. This will really affect you. And so that's my goal. My goal is to stop worrying and try to relax and find something that, that I like to do that will help me relieve that stress and that worry, that would keep my mind away from it, because with all that worrying and stress, it's just not going to happen. So, and I'll talk about the stress later, but let's go back to the exam. So she told me she didn't see a follicle big enough. And I was like, okay, at this point, I was just like, oh my gosh, of course, there's something wrong. And I'm like, is there something, like, she's like, it doesn't necessarily mean you're not ovulating. It could just be that you haven't ovulated. And I'm like, is there medication to treat it if I'm not ovulating? And my reasoning behind that question was, I don't need something else to worry about. Like, great, now I'm not ovulating. So I'm like, okay, let's look at a way maybe we can fix it. So is there a medication that would help me, or that would, and I believe it's actually Clomid. If I'm not mistaken, don't quote me on that, I'm not sure. So yeah. She said there is. Don't worry about it. I'm like, okay, great. So I was happy going forward. I actually have blood work on Friday, and it's cycle day 21, and it's progesterone levels. So they're going to check my progesterone level, and I believe from that she can actually see if I have ovulated or if, I'm not sure how they determine, but I'm sure it'll tell her something, like whether I ovulated a few days ago, or depending on my level, it would mean, how long ago I ovulated or if I'm ovulating or whatever. So I'm actually probably not going to get the results to that, simply because on the 16th of September, we have our plan of treatment. So I'm excited about that because it's finally a step in, we already, did all the IVF pre-testing. Kevin, which is my husband, he actually went for a semen analysis this past week. This is his third one. So our issue was the low sperm count. For those of you that haven't seen my first video, he had a really low count. So that was the issue. And they wanted to do a third semen analysis just so the doctor could have a fresh result right before the plan of treatment. So in the plan of treatment, I believe I discussed a little bit about this on the first video, but they're basically going to go over all the results of all the pre-testing I did and whatever he did, and they're going to talk to us about it and come up with a plan of treatment for us. So hopefully we talk financial, and we talk dates, so medications, how many injections I'll need and when I can start that. And I actually needed, I was hoping I'd start right away because my appointment's on the 16th and my cycle usually starts around the 17th or 18th, but that's a little too soon. And I ended up needing an MMR vaccine. So I needed a booster shot because I was no longer immune. I guess my levels were too low. So I went to get the booster shot. I want to say it was Thursday. I went to get that booster shot, and I have to wait a month because it is a live vaccine. So I have to wait a month before we could start trying. So a month would be probably, say, October 1st. And then my cycle starts on the 17th or 18th. So it'll give me, I have to wait just 2 extra weeks, which is not a big deal. It gives me time to get my finances in order and everything else. So I'm excited about the plan of treatment. I will let you guys know how that goes. If you have any questions, please don't hesitate to ask me. You can message me. I'll try to put my email down at the bottom on the description, and feel free to email me. It doesn't bother me. I am one that likes to watch videos, to ask questions. I like to be informed, and there's nothing like having someone to ask when you're going through this journey. It's very stressful. It's nice to have someone that, you can go to or ask questions. And please go ahead and email me or just anything. That would be great. If you have any questions or there's something you want me to discuss or want me to make a video about, please let me know. I'll be more than happy to do it. I did try to get Kevin to take pictures and videos, but it's kind of hard. They didn't let him in on the first exam just because those exams are kind of sterile. So it's a little harder to have him in there. But I'm hoping they'll let him in the egg retrieval day and all that stuff. I don't know if they will. I'll keep you guys posted. Again, if you have any questions or any comments, just ask away and I will gladly answer them. And please like and subscribe my video. Thank you.